Hello. I'd like to welcome you to this lunchtime talk on obesity in the UK. My name is Sarah Smith. I'm Professor of Economics and Head of the Department of Economics at the University of Bristol. And we're supporting the Festival of Economics both through this event and through a kind of an afternoon schools challenge, and also through subsidising some tickets for some students at the university. So I think it's really good that we're involved in the Festival of Economics. The last few years have been quite a challenging time for economists. We've had come under some flack for failing to anticipate the crisis, and we've been kind of seen as increasingly irrelevant to sort of current policy. So I think something like the Festival of Economics is fantastic. It gives an opportunity for kind of academics to engage directly with kind of the public, and hopefully we can begin to convince you of our usefulness. So Rachel today is going to talk about obesity in the UK and hopefully offer some insights into what economic analysis can offer in terms of both understanding the problem and also providing some potential solutions. So yesterday, it's kind of very topical. Yesterday, McKinsey's published a report highlighting the scale of the problem of obesity globally. And so for the UK, they estimated that obesity was costing roughly kind of 3% of GDP. So we might kind of want to disagree with the exact numbers, but I think it gives you some sense of the scale of the problem. And I think most people would agree that, you know, it is an issue that needs kind of public policy interest and raises public policy concerns, and hopefully it's something that economists have something to say about. So I'm really pleased that Rachel's here today to sort of talk about this issue. So Rachel is Professor of Economics at the University of Manchester and Deputy Research Director at the Institute for Fiscal Studies, which is kind of an institute well known for applying kind of rigorous economic thinking and empirical analysis to sort of public policy issues. So Rachel is also a Fellow of the British Academy and editor of the Economic Journal, which is the UK's leading academic economic journal. And she's also been elected to serve as President of the European Economic Association. And she'll be the first woman to hold that post when she takes office in 2015. And believe me, in a male-dominated profession, that is no mean feat. So Rachel is a leading researcher in studies of firm innovation and productivity. And in recent years, she kind of turned her focus to thinking about the sort of retail food sector and also nutrition and individual dietary and food choices. She currently holds a major European Research Council grant and is leading a team of researchers using very detailed kind of microdata and economic analysis to understand consumer food purchasing behaviour and firm food pricing behaviour and their impact on nutrition and health. So that's what she's going to talk to us about today. So she's going to talk for, I think, just over half an hour and then leave plenty of time for questions afterwards. So I'd like to ask you to join me in welcoming Rachel to talk to you about obesity in the UK. Thank you very much.
So today I'm going to talk about obesity and kind of, I hope, as Sarah said, convince you that economists have something to contribute to the debate. I'm not going to be able to provide you with answers to, how public policy can solve this very major problem. Those are well beyond my capabilities. But what I hope I can do is provide at least some interesting questions and ways that we can think about getting the types of answers that we might want. So as Sarah said, headlines in yesterday's newspaper suggested that obesity was one of the top 3 global issues. The report by McKinsey said that something like 1/3 of the world's population is now overweight, which is quite a shocking statistic, and that about 5% of deaths can be attributed to obesity. So as I said, we can quibble about the exact figures, but they're pretty shocking, however we think they are. So the figures in the UK are even more shocking. The UK is one of the countries that has experienced some of the worst problems with obesity. Something like 2/3 of adults in the UK are now overweight, and around 1/4 of adults are obese. So just to be clear about what I mean by that, so there's pretty precise medical definitions about what a healthy weight is for your height, and obese means that you've really gone over or are very high in that distribution. So another way of thinking about that is if we compare how much the average person weighs today with something like 3 decades ago, the average person weighs about 10 kilograms more today. The average adult person weighs about 10 kilograms more today than they did yesterday, that they did 30 years ago. And I guess perhaps one of the more worrying statistics is when we look at children and the growing rate of obesity in children, where where we might think that there's more important long-term consequences. So what I want to talk about today is the economics of this problem. A lot of different disciplines think about these issues, and I'm going to really focus on the economic issues. And so what I want to start by talking about is, why is this a problem? Frankly, if I want to go eat a few biscuits and get a bit chunky, why does anyone care? That's my business. Why can't I just make that decision on my own? So the way economists think about this problem is that being obese, or being overweight, has been shown in the medical literature to potentially lead to other types of disease prevalence. So it may lead to problems in your, with increased rate of heart attack, increased risk of diabetes, and particularly in children, if young children have poor diets and are obese, it may lead to longer-term developmental problems. So the reason that this may be an issue of public policy is that to the extent that people are not taking this into account when they make their food purchasing decisions. So when I decide to pig out on biscuits, if I'm completely aware that that's going to make me a bit chunky and die a little bit earlier, that's my business. And if that doesn't affect anyone else. But if maybe I'm not really aware of that, or if somehow, some external organization like a firm advertising has made me forget about the fact that biscuits are going to make me gain weight, and so I don't take that into account when I make my decisions about eating biscuits, then there may be a role for public policy to play in helping me make decisions that fully reflect the implications of what I'm doing. And that's the kind of thing that economists think about a lot. So one thing, before I talk more specifically about that, one thing that I'd like to emphasize is that I'm going to talk mainly today about obesity, but obesity really isn't the only issue at all. There's not very good statistics on this, but there's some evidence to suggest that it's not only that people are gaining weight, but that the quality of people's diets are declining. So that ironically, while people are eating too many calories, they're also eating the wrong sorts of calories. And so there's a form of malnutrition. Not malnutrition in the sense that people are starving, but malnutrition in the sense that they're not getting key nutrients that they need to develop healthy bodies. So again, that's particularly a concern in children, but we kind of have this ironic situation in that people are eating a lot of food, but they're not getting the bits of food that they really need to be healthy. And so we may care as much about the types of foods that people eat as the amount of food they eat. In fact, we may care more about that. I'm going to talk a little bit about that, but perhaps focus less on that. But I said what I really want to talk about is some of the economic factors that may be at play here and some of the ways that policy may influence decision-making. I'm talking about this not because I think the economic factors are the only things that matter, and not because I think that there aren't other things that may be even more important, but this is the Festival of Economics, and I'm an economist, so I'm going to focus on economic factors. There will be psychological factors and all sorts of other factors that are also very important, but what I'm going to focus on is economic factors. So I'm also mainly going to focus on food markets in most of what I talk about. So I'm going to talk initially about how policies that might affect the types of foods that we buy and things like that. But I want to also, I'll come back at the end to be clear that that's only one part of the equation. People gain weight because there's an imbalance between how much they eat and how much energy they burn. And so I'm going to focus largely on the eating part, but at the end I'll talk some about the energy burning part, because that plays an important role too. It's not just about food, though most of the policy initiatives have really been around the food markets, and I think there's some good reasons for that. It's also perhaps where economists may think they have more to say in thinking about people's food choices. But over the last 30 years, as well as there being changes in the food market and the types of foods we eat, there have also been big changes in the way we spend our time and the types of activities that we do. And as I said, I'll come back and talk a little bit about that at the end, and there may be important policies that can change that. So, at the heart of the debate about what kind of policies that we might think about implementing, what kind of economic policies we might think about implementing to address this problem, is really the issue of how much we think that people should be left to their own devices to make their own decisions about what they eat and what they feed their kids, versus how much we think governments should intervene. And that's really been one of the big aspects of the political debate. So one of the things I want to get across today is sort of the range of policies and also how interventionist governments already are in this area. The food markets have a lot of policies that influence them already. But one of the big high-level debates, if you like, is the kind of difference in the view between we really should give people information and let them and set up the market in a way that we allow people to make their own choices and then leave them to make those choices, versus people may suffer from some kinds of self-control problems and not really be taking the right decisions even when they have the right information, and we may want to try and change the decisions they make in a sort of slightly more paternalistic way. And a lot of the discussion has been around those issues, about which of those things do we want to do and which of those can we achieve. Do we want to enable people to make choice, or do we want to really intervene and help ensure that they don't become victim to their own lack of self-control or something like that. Okay? And of course there are many areas of policy where we intervene quite a lot. So cigarette smoking is an example where initially the government's policy responses were to provide people with information about the dangers of cigarette smoking, but then eventually we started banning them and were much more interventionist. Same thing with seatbelt laws. We didn't used to have seatbelt laws. Then there was campaigns to click and buckle up, and they didn't have huge effects, and then now we have mandatory regulation that you have to wear a seatbelt. And so the same people argue about the same types of things in food industry. Should we be leaving people to make choices, give them information, or should we be really changing the market, regulating the market in a much more strong way, as we do in other markets? And this debate really came to the fore, if you like, when the coalition government came into power, because that was a real shift in the viewpoint on that. And the health secretary at the time, Andrew Lansley, made some very clear statements that in his view, and in the current government's view, what they really were all about was what they say is empowering people to take personal responsibility and make their own choices about what food and drink to eat and what food and drink to give their children. And he really wanted the government to do less what he called hectoring of people to live a healthy lifestyle, and more about encouraging voluntary behavior by firms and individuals. And the other side of the debate has been particularly vocally the medical bodies, who really argued for much more strict regulation, banning of some foods, mandatory reformulation of foods, much more interventionist type approach. And so what, so how do economists step into this debate, and how can we help? So what I want to sort of think about is what are the things that are going wrong in markets, and what are the ways in which government policy might influence, what sort of policy tools do governments have to try to influence behavior in markets, and how effective will those be? And so in trying to understand, is what's happening that people lack information, but if you give them information, they'll make the right choices, versus even with information, people are not making good choices that are good for them in the long run. And so what I want to do is sort of first set out these policies and how we think about them from an economic point of view, and then talk about some of the, the ways that we can evaluate the effectiveness of these policies, and in a way highlight some of our ignorances, which are very large. So I want to start by talking a little bit about what might be going wrong in food markets. So what's led to this big increase in obesity? Food's been around for a long time, and this is a very recent phenomenon. It's really the past 20 years or so. So why is the world different? What's happened? So as I've already alluded to, one of the really key things that people focused on is on information, is on the role of information in the way that people make decisions. And so there's kind of two ways to think about that. So one is the information that people have available to them, and the other is the willingness for the people to act on that information. And one of the things that economists have sort of paid increasing attention to is how those two things might have changed, or how they might how they might work in food markets. So if we think first about the form of this, what might be going wrong to the extent of the type of information that people have available to them? So trying to answer the question, if is the government's role really just in giving people the information they need, and then we can leave them to it and they'll make the right kinds of decisions. So the kind of information that we'd be interested in thinking about is whether people fully understand the types of the nutritional characteristics of foods they're buying, whether they understand their own nutritional needs, how many calories I need, how much of different types of calories do I need, whether they understand the costs that are associated with consuming particular foods. And so what we're, so that's very much thinking about how much people know about the decision, the types of foods that they're choosing to eat, and the effect that they'll have on them in the long run. If that's the problem, then we can think about a set of policies that would provide them with that information at the time that they're making the decision. In contrast to that, it may be that people fully understand what food. We all know that an apple is good for us and a Mars bar is bad for us. We fully understand, we have all the information we need, but we don't act on that information when we're making decisions. So we have self-control problems. I really didn't want to eat those biscuits. I made a decision this morning when I woke up that I wasn't going to eat the biscuits, but the biscuits are there in front of me, and I just can't resist, and I gobble the biscuits. And if that's my problem, then telling me that biscuits are bad for me and apples are good for me isn't going to change anything. And the role that we would want policy to play is to somehow not have those biscuits be sitting in front of me at the time that I'm tempted to gobble them up. And so that's the kind of debate between people who think that markets will work on their own, so the current government, that markets will work on their own, let people make choices if you give them information, versus we want to remove temptation. And so one of the most compelling places that we can think about the problems of temptation and lack of forward-looking behavior is with children. So clearly we don't think that a 5-year-old child, if you give them a Mars bar, is going to think about the implications that that's going to have for their earnings 20 years down the line. And there's pretty good evidence that feed 5-year-olds a lot of sugar, they're going to have there may be developmental issues, and they may do less well at school, and they may end up getting a job that doesn't pay as much. So we pretty much understand that that child isn't going to fully take that forward-looking behavior into account. So maybe we might think their parents will. That's a question. Is that a role for the parents or for the state? That's a sort of political question. But those would be the kind of things that we'd be interested in trying to understand is, to what extent do people fully understand the implications of what they're doing and they're making conscious choices, versus to what extent do people not really fully appreciate the implications. But that would always have been true. It's not like 100 years ago people had information or made decisions in different ways than they did now, perhaps. Well, one of the things that we think might be very different, and it's the subject of a lot of my research, is that a lot more of the food industry is now processed foods, and a reasonably small number of firms now play a very active role in producing foods that they sell to consumers. Whereas in the past, people bought more of their food in a more raw form, in the form of ingredients. And so it may be that firms play an important role in projecting certain characteristics about foods, that leads to people having misconceptions about the characteristics of foods they're eating. So if you're buying a piece of a vegetable or a bag of flour, it's very clear what it is because there's only one ingredient in that thing. But if you're buying a processed, packaged food, it has 20 ingredients, and you have to get your glasses out and read the 3-point font on the back and understand what all the different ingredients are. And most people don't do that. And so there may be and firms, put labels on that give you project a certain image of a food. And so there may be important ways that the food industry has changed. That means that firms are advertising foods in different ways, or they're providing information that's either intentionally or unintentionally misleading. So I was in the supermarket the other day and I saw a pack of marshmallows. Right? Marshmallows are made of sugar and water, basically. And on the front it said, fat-free marshmallows. That's a hilariously irrelevant piece of information, right? Marshmallows would never have fat in them, and it's trying to make it, think I'm on a fat-free diet, and so those marshmallows are going to be really good for me. And so there's all sorts of ways in which firms may, portray their goods in order to make you think there's something different than they are, and the consequences of eating that food may be different. And so that's possibly one of the things that's really changed in the food market in the last few decades. So I've pitted these two things against each other as if they're sort of really different things. Of course, they may interact in important ways. It may be that the lack of information and the lack of willingness to act on that information are not just independent things. As I said, the rise of processed food as a share of what we eat and the lack of clear labeling is clearly partly about the information that people get and partly about the way people react to that information. But basically, that's an area where we don't really have a very good idea about what's going on, about whether people understand the qualities of foods that they're buying, or whether they understand them and they are lacking self-control. And that's a very active area of research where people are trying to gain more information. So some recent data from the NHS, from a survey for the NHS, suggested that people do actually have a pretty good idea of what's good for them. People know, when you ask people what's a healthy diet, they all understand that eating fruit and vegetables is a very important part of a healthy diet. And they all, understand many other complicated things about eating a good diet. Though there's other important ways in which people are pretty ill-informed. My husband, who's a very smart man, he's also a professor, and he's very active and very fit, once said to me, I said, "You eating another piece of chocolate cake?" And he said, "It's okay, I had an apple this morning." That's just not true. Apples don't cancel out chocolate cake, right? But somehow people, have these ideas that it's okay if you do one and the other. And so, even people who seem to be informed about things may be ill-informed about other things. So there's also a lot of other factors at play. I was talking to someone this morning about other things that have changed in the way that we interact with food. Or there's much more snacking now. Snack foods, that's a pretty new industry. Prior to sort of 1980s, snack foods didn't really exist. That's a big industry of the big creation of the fast food industry. And the way that people eat and interact with food has changed a lot. It used to be much more common to sit down and eat a meal. That was the main activity. You were sitting in front of your food. Now it's much more common to sit and eat in front of TV. And there's quite a lot of evidence that that sort of unconscious eating leads to people eating different types of foods and eating more. That a lot of your understanding of how full you are and how much food you've eaten comes from your brain, not your stomach. So being full is a thing in your brain, not your stomach. And so if you're not paying attention to what you're eating, you may eat a lot more than you do when you're paying attention to it. So it's not only the sort of advertising of food that's changed, it's the way we interact with food that's changed quite a bit. Okay, so I keep on promising to talk about policy. So what are the kinds of policies that are available in this area? So one thing is there's a very wide range of policies that in fact we already have. The food industry is a very regulated industry already, and there is a whole ton of the McKinsey report, which was published yesterday, makes for a very interesting read, and they actually summarize 78 different types of policies that are currently in place relating to the food industry and obesity around the world. And so the types of policies that I want to think about are these. So one thing that governments can do is provide direct information on food. So if we think that the big problem is that people don't know what's good for them or don't know about foods, governments can do things like, and this is an area where governments are very active, like the 5-a-day program, eat 5 portions of fruit and vegetables a day. In Denmark, it's eat 6. They're more optimistic there, more ambitious. So yeah, that's about directly providing people information. You know, that policy has been shown to have had very little effect. And one question is why that's true, possibly because people already knew that fruit and vegetables were good for them, and so that wasn't big news, but there's other potential reasons. But labeling, like the traffic light labeling scheme is another way that governments regulate and try to provide information. You know, most of the research has showed that general information campaigns, when you tell people eat more fruit and vegetables, don't have a big effect, but that when you really target information, it can be much more effective. And so why is, you know, one of the difficulties in the food policy area is that either the messages are too simple, and so they're already known, like vegetables are good for you, we've all known that for a long time, or they're too complex, like the saturated fat campaign was a very complex campaign where people kind of got the message that they shouldn't eat saturated fat, but then they didn't know what products had saturated fat or how they should act on that. So the information wasn't very clear, and it was really too hard to give people a clear message. There is some suggestion that very individual tailored messages might be more influential. So if your doctor sits you down and talks to you about your diet and says you really need to have, you know, more broccoli in your diet and less cake, then people may react to that better. But so direct information is a type of campaign, of intervention that has been very popular in the past, but perhaps has been seen to be less effective. Providing education to help people process information is another thing, and lots of schools have lots of different types of education. Different types of regulation, like banning goods or restricting them, not allowing soda in school, not allowing certain types of advertising of goods. We have restrictions on alcohol advertising, for example. Regulations that provide goods, so for example, providing free water so that people aren't tempted if they're thirsty to buy an unhealthy soda or something. Different types of income policies, so giving poorer households income to spend on healthy foods, are types of policies that we have. In the UK, we have something called the Healthy Start voucher, which provides vouchers to poor households to buy fruit and vegetables. It's been seen to be reasonably effective. And then there's a set of policies that are kind of on the border between economics and psychology, which are about, which are referred to popularly as nudge policies, which are about trying to change the environment in which people take decisions, you know. And of course, one of the things that economists talk about a lot is policies that try to change prices. So things like taxes or subsidies that try and change the relative price of different goods. So taxes on soda. Lots of countries have taxes on soda. France has the Red Bull tax. The US has taxes on sodas in many different states. Denmark has a fat tax. We tax alcohol everywhere. Those have largely been seen to be pretty effective. In the area of regulation, one issue that's been raised a lot in the UK is whether planning regulation should be used to limit the location of fast food stores. And in fact, it is already used to some extent. And there are statements from the NHS that say that local authorities should be encouraged to use planning regulation to modify the environment so that it doesn't promote sedentary behavior or provide easy access to energy-dense foods. So that's a more controversial policy, whether governments should actively try and take tempting but unhealthy foods out of the reach of particularly children, so locating them away from schools, in order to make it more difficult for them to choose that option, or whether that is too interventionist. So one of the types of regulation that I want to talk about in a little bit more detail, and that's been the focus of my work, has been restrictions on advertising. So there's been a lot of attention, and the medical profession has called for extension of restrictions to advertising of junk foods. So in the UK, we already have some restrictions to advertising of junk foods. So junk foods are foods that are high in sugar, salt, and saturated fat. There's a kind of official definition of them, but there'd be things like soda, chocolate, crisps, things like that. So we already have regulations that say that those junk foods cannot be advertised during children's TV programs. So that means before or after a program where children are the main audience. And there's been calls to extend that. It's shown that children, of course, watch TV at lots of other times. They watch soap operas or something, and so they would see adverts even though they weren't shown around children's TV times. And so there's been calls by the World Health Organization and other medical lobby bodies to extend that kind of regulation. So one of the things that, as economists, we kind of have the tools to do is to try and evaluate what the effect of that kind of policy would be. So the challenge we have in doing that is we haven't had a full ban on advertising yet. What we'd like to know is what would be the effect on outcomes, on behavior, if we banned advertising of junk food, on what would be the effect on how much junk food people bought and other potential outcomes. So the way that, as economists, the tools we use to do that are both economic theory and combined with sort of maths and statistics and computers and some very cool data, putting all of those together to try and basically simulate what would happen in the world if in a counterfactual world that we don't observe and that doesn't exist, if advertising was banned. And so I want to try and just talk you through a little bit of how we do that work and what we learn from it as a kind of way of demonstrating what economics can do. So the thing that we're interested in asking is, if we banned advertising, and I'm going to look at crisps in particular as an example of a junk food, if we banned advertising of crisps entirely, what would happen? And I'm particularly interested in two things. One is, what would happen in the market after the advertising ban? So what that means is I want to know both how consumers respond, if now we suddenly have no advertising, how does that change people's crisps purchasing behavior, and how do firms respond? So that's the kind of additional bit that we're really thinking about. So what will the market look like in the end when we don't have any more advertising of crisps? So why is that an interesting question, and why isn't it obvious to say what's going to happen? So first of all, we need to think about how advertising affects consumers' choices. So is advertising mainly about firms fighting over your purchases? So in the crisps market, you've all seen the Gary Lineker advert, I'm sure. That's one of the main adverts for crisps, is Gary Lineker eating Walker's crisps. Or Elle Macpherson, who's a supermodel, eating crisps. I'm sure she hasn't ate many crisps in her life. And so, what are those adverts? Those adverts have no information content, but what do? They lead you to think that you're going to be a football superstar or a supermodel if you eat crisps, right? It's kind of in the back of your mind when you see those adverts. So the question is, what do those adverts do? Do they lead you to buy Walker's crisps instead of Golden Wonder crisps? Is that the main effect of the advert? Or does the advert lead you to buy crisps rather than an apple, right? And so by banning advertising, what the government would like to achieve is to get you to buy the apple, not the crisps. But maybe all that advertising is really doing is you're going to buy crisps anyway, and it's just getting you to buy that brand versus this brand, in which case banning the advert isn't really going to have that much of effect on your consumption of crisps. It'll just lead you to go to a different brand, maybe. But if we also then think about how firms respond, firms are competing in this market. So they're competing on advertising. I pay Gary Lineker a lot of money because I want to get him to advertise my good because I want you to buy it. If I now don't allow you to do that, firms compete on other things as well. And so they're now going to compete maybe more vociferously on those other things. So in particular, firms also compete on price. How do I get you to buy my product? I advertise it, and I maybe charged a lower price. So now I can't advertise. What do? Well, I'm really going to compete with you on price. So now price competition becomes tougher. That means that prices go down. And that means that we buy more, because now they're cheaper, and so now you're going to buy more crisps. So what we do is we have an economic model that we can write down of the way that firms behave and the way that consumers take decisions, and then we have some great data on lots and lots of purchases that people make of crisps. And we can estimate that model using computers and maths and get what we would call a structural model of the crisps market, which just means that we think that we've uncovered the kind of key determinants of people's choices. And so with that model, we can then understand a bit about what drove your choices, and we can look at what the counterfactual world would look like if we didn't have advertising. And when we do that with the crisp market in the UK, what we see is sort of the story I just told you, is that mainly advertising is about stealing shares from each other, though a little bit it gets you to buy crisps as opposed to apples. But it also gets you to buy more crisps. It gets you to buy bigger pack sizes of crisps. So when you ban it, the first thing that happens is consumers buy less crisps, because advertising makes you like that product, like crisps more than other products, so you buy more crisps. So we ban it, you buy less. But then we look at what firms do. Firms compete more, prices go down, you buy more crisps. Those two effects almost entirely cancel each other out. So now we just have a world in which crisps are cheaper and they're not advertised, and everyone buys the same amount of crisps. So that's the kind of thing that, so that's a real project that we did with real data. And that's the kind of, tools that economists have to try and think through what happens in markets in more depth when we intervene with these policies. So the other, as I said, there was two questions we wanted to ask in that work. So one is this: what happens to the market in the end of the day? The other is, are people made better off or worse off? So the focus of the public health lobbies is to get people to eat less crisps. But we may also just be interested in not only do you eat less crisps or not, but are you better off or worse off in financial terms as well? And so we can also use these models to look at who's paid the price for that type of policy, and are people made better off or worse off? So it may be that those types of policies affect some people financially very differently to other people, and that may have sort of distributional consequences or something. So we can also use these models to say things about that. Okay, so we use those types of tools to look at a whole range of other policies. So I'm just going to give you one more example, and then I'll talk very briefly about time use. So one other example is there was a big campaign to try and get people to eat less salt in the UK. People eat way too much salt. That's actually been one of the more successful campaigns. We actually eat less salt now than we did 10 years ago. And that's been hailed as a pretty big success. So the FSA, the Food Standards Agency, was responsible for the policy in this area. And they had a policy it was an information campaign where they told people to eat less salt. And there was posters and adverts. And if you look before and after that campaign, you saw a big reduction in salt. So they did an evaluation, and they said, look, our information campaign has been very successful. And that was sort of big news, because information campaigns haven't been very successful. And I said that before, that information campaigns aren't really that successful. So we've looked at this, and one of the things is that at the same time that they had the information campaign, they also had an agreement with industry to undertake voluntary reformulation of products. So a lot of the reason that products have salt in them is because in the 50s, not so many people had refrigerators, and you needed salt to preserve goods. So if you ever look at how much salt is in a tin of baked beans, it's absolutely revolting. It's like 5 teaspoons or something. You'd never eat that much salt. But it was there because it was to preserve the beans, and we don't need that anymore because we have other technologies that help us preserve the food. So it was pretty easy for firms to remove salt from food, and it wasn't really something that people liked that much. In fact, with baked beans, they were putting sugar to mask the salt. So they could just kind of get rid of both. There was no cost to them, really. It was a minor cost to them, and it reduced salt a lot. And so what we showed is that actually, the entire reason that salt declined was because of reformulation. In fact, if you look at what people did, they substituted towards higher. People were choosing more salty goods, but the reformulation meant that the goods had less salt in them. And so that's important to understand. And so again, we could do that with data and computers and economic methods. And that's important because we want to understand which types of policies are effective, and it was really not the information campaign, it was the reformulation. Okay, so we can do that for a lot of other policies and sort of gain some insight into how they're working and how effective they've been. So just before I finish, I promised I was going to talk a little bit about the other side of the equation. So is the reason for the gain in obesity all what we might call gluttony? Is it all because we're eating way too much? Or is there something else going on? So the weight gain that we've seen over the past 30 years is about 10 kilos. For an average-sized man, that means that you'd have to eat about one extra biscuit every week for 30 years, and that would lead to that kind of weight gain. So one thing to note is that doesn't sound that much, actually. I mean, it's a little bit more complicated than that, but that's the kind of scale of things. And what's the case is that if we look at how calorie consumption has changed over that time, it doesn't account for that at all. In fact, if you look at our best estimates of how the number of calories that people have consumed has changed over time, is that it's declined. In fact, it's declined quite substantially. But what's happened is it's not declined as much as the amount of energy that we burn has declined. So people have changed how they spend their time and the strenuousness with which the activities they spend their time by a lot. And that isn't mainly about leisure activity, it's about things like work. So people spend about a quarter of their waking hours at work. And if you take an average man in a strenuous job, will burn about 60 calories during a year of work. So a strenuous job being like a builder or something. Whereas at a sedentary job, like a desk job, he'd burn like 15 calories. So 15 to 60, that's a huge difference. So, if we look 30 years ago, about 80% of men were in strenuous jobs. And that's shifted now to more like 80% in sedentary jobs. So there's been this huge shift from strenuous to sedentary jobs, and people have reduced the calories that they're eating, but not by as much as they've reduced the amount of activity. So for men, that's a lot about what they do at work. It's also about how they get to work and what they do in their other time. For women, it's more, women used to spend more time at home doing housework, which is actually a fairly strenuous activity. Now more women have gone into the labor market and are in sedentary office jobs. So moving from doing housework to sedentary work has also meant a reduction in calories expended, but in a kind of different direction. So that doesn't mean that the issues aren't around food in the food industry. It just means that it still means we're eating too much for the amount of activity, but it means that people are reducing how much they're eating, but not by enough, and that sort of slightly tempers how we might think about policy interventions. Okay, so I've talked for long enough. I want to leave some time for questions. But so what I wanted to highlight was just one, the really broad range of policies that are both in place and that are open to us, and the tools that economists can use to try to evaluate these. One of the things that the McKinsey study highlighted that I particularly liked and I thought was important was that people and politicians in particular have a bit of a tendency to try to look for the one silver bullet policy. And it's pretty clear in this area that there isn't a silver bullet policy, that we clearly need a range of policies, that it's really not going to be, a tax on biscuits is not going to solve the obesity problem, or a tax on soda in itself. It may be a part of the answer, but that in itself will not solve the obesity problem. So I'm going to finish there and open the floor to any questions or comments any of you might have.
When it comes to public policy, one thing you haven't mentioned is healthcare systems. So I was wondering if there's any research that's been done on how different healthcare systems in different countries or different markets would influence how people's behavior is in terms of healthy foods. So if you have public or private health insurance, does that affect your kind of incentives on how you eat or how you view the consequences, or maybe the access to information you have in terms of what you eat and what's healthy or not?
That's a great question, and the answer is no, I'm not aware of any evidence on that at all. I mean, there are really big differences across country in what people eat. part of some of the research I've done has been showing that, for example, in France, people eat very high-fat diet and are much less obese than in the UK and the US, where we eat a lot of carbohydrates and are much fatter. So one thing that there is, the way we treat obesity is very different and is related to healthcare systems. So in the US, there's a big move to medically deal with obesity as opposed to try and prevent it, preventative action. But that's a great question, and we should do more research on it. That's probably going to be the answer to most of the questions I get asked. There's another question over here.
Up until about the 1950s, the tobacco industry didn't really have too much to worry about. Even medics would recommend people would smoke if they had a bad cough. No one argues that tobacco is harmful now, but tobacco industries haven't gone away. The food industry will have no problem sidestepping any criticism of what they sell, and they're going to fight very hard to avoid any sort of interventions that would make their products less attractive or more expensive. How are you going to cope with that?
So I'm not going to cope with it. I'm an academic economist, not a policymaker, thankfully. But, well, so the regulation, so that's the argument between whether we leave people. I think that's the most compelling reason to say that, for the arguments that we should have more intervention, that it's the sort of state has an important role to play in mitigating the effects that large firms have on consumer behavior. And, in the tobacco industry, I guess that's been pretty successful. The smoking rates are way less than they were before, and that's been largely to do with regulation and taxes. And so I think that's the parallel that a lot of people draw who are lobbying for more direct intervention, is exactly in the cigarette industry. Yeah.
What's your view on sponsorship of big events by food companies? I'm thinking about the Olympics, which I think was sponsored by, if I'm right remembering, a drinks company, Coca-Cola, McDonald's, which seems shocking for such a high-profile sporting event. What's the impact of that sort of endorsement, do you think?
Again, I'm going to sound like a bit repetitive here, so that's a great question. I don't know if we really directly know the answer of the effects of sponsorship as opposed to other forms of advertising. I think we know for sure that advertising has a big effect on people's decision making. And in the work I talked about, for example, on junk food, we show in that work that not only does it have an effect on what you buy, but we can show that it changes how much attention you pay to the health consequences of the foods that you're buying. So it really affects that directly. Now, sponsorship is in that advertising. We haven't separately looked at, does sponsorship play a different role to other forms of advertising? But I don't know. So I don't know if it does particularly or not. But I would imagine it was pretty similar, actually.
You've been talking about the input and the output very much, and you've really defined the problem as being that we're doing a lot less activity than we used to, rather than we're eating more. We're eating less, you've said, but we're doing a lot less activity. So really the focus ought to be on trying to encourage more activity, that the input side of it is relatively small, but the output side of it, i.e. the level of activity, is probably far more important. For the children watching the advert, it's not the fact that they're watching the advertisement for crisps, it's the fact that they're watching the television at all. Is the real issue, and that they're not outside playing. So should we be looking at policies to try and design in activity into our environment?
Yeah, so I hope I didn't sound like I was saying that. So I think it's pretty clear that we need policies on both sides of the equation. It's probably a lot easier for government to... So when you think about government policy, there's a couple things you want to think about. And one of them is, the government may well want to intervene and want to achieve an outcome, but it may not have policy tools that let it do that effectively at a reasonable cost, or even just at all. And I think, so I don't work on encouraging physical activity, I work on the food industry. That's why I mainly talked about the food industry. That's also where more policy activity has happened, I think. But I've heard people argue that that government has more tools to affect change in the food industry than it does to affect change in how people spend their leisure time. It's a more regulated place. It's, regulating how people spend their leisure time is a bit of a difficult thing. It can make facilities available, but we can't make people go out and do something with their time, whereas we can restrict food. So that's not to say that activity isn't super important. It's just that we may not effectively have the same tools that allow us to do that. And I think it's wrong to say that food, just because we're eating less, it doesn't mean that food's not a problem. I mean, I didn't talk a lot about it, but there's a lot of evidence that we've really changed the type of foods we eat. We're eating a lot more sugars. There's other people in the room who know more about this than me, physiologically, that that's really changing the way that that has a big effect on obesity. So it's not just the amount; it's the type. But we're still, we're eating too much for how much activity we do. So it's still a food issue. But I agree with you; we should be working on both sides of the equation, definitely.
Obesity is linked to deprivation. People living in more deprived communities are more likely to be obese than people living in more affluent areas. I'm wondering if your economic modelling tools that you use take that into account and can look at impacts based on different demographic factors to different population groups.
Yes, they definitely do, and more than that, that's something we're very interested in. So those two things are correlated. It's not clear which way the causality goes. So if there's a lot of evidence, if I pig out on sugar and biscuits when I'm 2 years old, my brain doesn't develop very well, I don't do well at school, I don't get a good job, then I'm poor when I'm older. So we don't know a lot. There's a huge area of research that we really don't know very well of the direction of causality between health and wealth in general. The two are definitely strongly correlated. Which one causes which, we're unsure about. And it may even be that it's a bit more complicated than that because it's habits that develop when you're young that are a function of your environment. There has been some very good studies that show that if you take people who have low income and eat a bad diet and you give them some more money, they don't suddenly eat a better diet. So it's not causal in that instantaneous sense. That doesn't mean that it's still not causally related because there may be habit formation and long-term issues around deprivation and low education, et cetera, that are related. But that's not the prime focus of my research. I take it into account, but there's definitely economists that are doing a lot of work on that area in general.
There was one point which you stated about how advertising and the banning of advertising would lead firms to compete on price or on other factors instead of advertising. Just to me, this sounds a lot like something which can be modeled using a computer, but which, when exposed to human intuition, sort of breaks down. Have you considered how firms may illegally collaborate on pricing, actively engage in avoiding price wars, so as to ensure that competition is kept to a minimum and that profit margins are kept to a maximum? The Chris market, to retake the example you mentioned in that specific domain, is dominated by what was essentially a range of duopolies, Walkers, Lay's, Pringles, McCoy's. These are all very familiar brands, and we can imagine that it would take a minimum of cooperative collaboration for these prices to be fixed at a level which benefits the producer rather than the consumer.
So that's a great question. I have very much considered that. I worked for many years at the Competition Authority in the UK, where that was exactly my job. So, so when I said they compete in prices, what I actually did was I allowed in the model for them to do different things. And the data tell me that that's what they do. So the data could have told me that they increased prices or that they collaborated in other ways. But it didn't. It told me that they compete, that they lower prices, that when they do less advertising, they compete more in prices. So we could argue about the fineries of my specific economic model, and of course you can always do that with any economic model, but it's not that I've imposed that they do that. It's that I have allowed them to behave in different ways, and I've used the data to tell me about how they behaved. Of course, collusion is illegal in the UK, and so you know, in most of what we do, we presume that firms don't do illegal things. But as I said, that's an area of great interest, and many economists work on trying to detect whether firms are competing or colluding in price. It's not unusual to find that they're competing. Even with in an oligopoly with a small number of firms, it can be very hard to sustain a cartel, and that's the case in crisps, I guess.
So you've said that you are not specifically a policymaker, but you are in a position of, you know, good knowledge on the subject. So I'm just curious to know, if you could make one policy, what would that policy be? What would you specifically say if you could implement just one?
Yeah, so as I concluded, I think there isn't one policy that you could do. So I think that that's a key thing in this area, and I think that in a way that's one of the nicest things, that the most important things that the McKinsey study highlights, is that, you know, has been shown in many countries. So for example, Denmark introduced a fat tax. So if you take the example of crisps, so if we wanted to improve people's diet and we put a tax on fat in crisps, what do people do? Well, what one study showed that looked at in Denmark, where they actually did that tax, they switched to sweet things. So they started eating more sugar. So with any one policy, you always run the risk that you may improve that particular outcome, but because health is a very multifaceted thing, you don't fix something else. So I think it's pretty hard to think of one policy. I'd go back to the guy who asked the question earlier. Probably one policy would be more PE in school or something like that. But I think if you're talking about the food industry specifically, it's pretty difficult to think of one policy that's going to solve all the problems, and that you really need a portfolio of policies.
If people are obese and they have medical problems and education attainment problems, which means that they die sooner, then is that not counterbalanced with the fact that we're not paying the government? I mean, from a government policy point of view, because one of the things that they keep saying about obesity is that it's expensive because people have more health problems. But if those people are not having late in life health problems, which are more expensive, and being paid pensions, does that not balance out?
Yeah.
So people could just eat what they want and die when they do.
Yeah. No, so that's a great point. They do say that. You'll notice I didn't say that. So when I give a more academic and longer version of this talk, I talk a lot about that. So, you know, with smoking, it's pretty clear that it's cheaper to the NHS if people smoke and die young. With obesity, it's a little bit more tricky. It's probably cheaper, but people who are obese, they tend to die in a very expensive way. So we don't actually have the numbers, but it's still probably, like you said, we save in pensions, So I very carefully didn't use that as a motivation. The motivation I used was, you know, if we think the problem is that people are not fully taking account of the consequences of what they're doing, and they want to be, and, you know, they're not doing that because, for example, firms are fooling them by providing false advertising or misleading them, then there's a role for government to play, not because of the costs, but because, you know, as a protector, you know, you as a consumer protection kind of issue. You know, you think that you're buying marshmallows and they're healthy because they say low-fat marshmallows, but that's not true. And so there's a role for government to sort of provide accurate information and provide an environment in which you can make the decisions that you truly want to make. I think that's the most compelling reason for intervention here. So it's the extent to which we think that that's the issue in the market, and that particularly with children. So if we think that parents, you know, adults in a way, they make their own choices, but with children, if their parents are not playing that role effectively, or if for some reason the food industry has become much more powerful and there's a stronger role for government to play, then I think so. But I completely agree with your comment. Yeah. I've been told I have to stop.
Yeah, so I'd just like to finish by thanking Rachel very much for a really informative and interesting presentation and discussion.